Clinical manifestations of Cushing syndrome, glucocorticoids. So these glucocorticoids, they affect almost all cells of the body. So these affect almost all cells of the body. So signs of cortisol excess impact multiple physiological systems. So if there is a cortisol excess, what will happen? So there will be upregulation of gluconeogenesis, lipolysis and protein catabolism. So these cause the most prominent features. So if there is excess cortisol, what will it lead to? It will lead to upregulation of gluconeogenesis. There will be lipolysis and protein catabolism. So these are the most prominent features. And if there is excess glucocorticoid secretion, what will happen is it will overcome the ability of 11 beta hydroxysteroid dehydrogenase 2. So if there is excess glucocorticoid secretion, it will overcome the ability of this 11 beta hydroxysteroid dehydrogenase 2. So this enzyme is actually important for inactivating cortisol to cortisone. But in the kidney, so thereby exerting mineralocorticoid actions, and this will manifest as diastolic hypertension. So in addition, what will happen is this excess glucocorticoid secretion, so this will overcome the ability of this 11 beta hydroxysteroid dehydrogenase to rapidly inactivate cortisol to cortisone in the kidney. So this cortisol won't be converted to cortisone. So what will happen? There will be thereby exerting. So this cortisol, it will exert mineralocorticoid actions, and this will manifest as diastolic hypertension, hypokalemia and edema. And this excess glucocorticoids, what does they do? They interfere with the central regulatory systems. That is, they suppress the gonadotropins. So this will lead to hypogonadism and amenorrhea. And these glucocorticoids also suppress the hypothalamic pituitary thyroid axis. So this will result in decreased TSH secretion. So if excess glucocorticoids are there, what will happen? So this will interfere with the central regulatory systems. So because of this excess glucocorticoids, there will be suppression of the gonadotropins. So because of the suppression of gonadotropins, it will lead to hypogonadism and amenorrhea. And there also will be suppression of the hypothalamic pituitary thyroid axis. So this will result in decreased thyroid stimulating hormone secretion. The majority of clinical signs and symptoms observed in Cushing syndrome, they are relatively non-specific. So what are the clinical signs and symptoms in Cushing syndrome? They are obesity, diabetes, diastolic hypertension, hirsutism and depression. So that are commonly found in patients who do not have Cushing's. Majority of clinical signs and symptoms are non-specific. So what are these non-specific signs? Obesity, diabetes, diastolic hypertension, hirsutism and depression. And therefore, careful clinical assessment, this is an important aspect of evaluating suspected cases. So a diagnosis of Cushing's should be considered when several clinical features are found in the same patient. In particular, when more specific features are found or manifest at an unusual age. So when should we consider the diagnosis of Cushing's? That is when there is a osteoporosis in a young patient. And what are the other distinct features? The distinct features of Cushing syndrome include fragility of the skin. There will be fragility of the skin, easy bruising, and there will be broad purplish stria. That is, the purplish stria will be broad, that is greater than 1 centimeter, and there will be signs of proximal myopathy, which becomes most obvious when trying to stand up from a chair without the use of hands or when climbing stairs. What are the distinct features? The distinct features include fragility of the skin. There will be easy bruising and broad, greater than 1 centimeter purplish stria, and there will be signs of proximal myopathy. So this becomes most obvious when trying to stand up from a chair without the use of hands or when climbing stairs. So the clinical manifestations of Cushing's do not differ substantially among the different causes of Cushing's. So in ectopic ACTH syndrome, hyperpigmentation of the knuckles, scars or skin areas exposed to increased friction can be observed, and this is caused by stimulatory effects of excess ACTH and other POMC cleavage products on melanocyte pigment production. So what happens in ectopic ACTH syndrome? Hyperpigmentation will be there of the knuckles or hyperpigmentation of the scars or the skin areas which are exposed to increased friction. So this can be observed. So why? Because of the stimulatory effects of the excess ACTH and other pro-opiomelanocortin cleavage products on melanocyte pigment production. So because of this excess ACTH and because of this POMC cleavage products, what will happen? So there will be increased pigmentation. Furthermore, patients with ectopic ACTH syndrome and some with adenocortical carcinoma as a cause of Cushing's. So patients who are having the ectopic ACTH syndrome and patients with adenocortical carcinoma, so as a cause of Cushing's, what will happen in malignancies is there will be a more brisk onset and rapid progression of clinical signs and symptoms. So in these patients, what will happen? There will be a brisk onset and there will be a rapid progression of clinical signs and symptoms. Mainly there will be edema, there will be hypokalemia and hypertension. So what are the clinical signs and symptoms? There will be edema, there will be hypokalemia and hypertension. And patients with Cushing syndrome can be acutely endangered by deep vein thrombosis. So Cushing syndrome, they'll have this deep vein thrombosis, so with subsequent pulmonary embolism due to a hypercoagulable state associated with Cushing's. So they will have this deep vein thrombosis, they'll have the pulmonary embolism, and there is a hypercoagulable state associated with Cushing's. The majority of patients, they also experience psychiatric symptoms. So in Cushing syndrome, there will be psychiatric symptoms in the form of anxiety or depression, but acute paranoid or depressive psychosis may occur. So majority of the patients, they'll have anxiety or depression, but they can also have this acute paranoid or depressive psychosis. So even after cure, long-term health may be affected by persistently impaired health-related quality of life, and there is increased risk of cardiovascular disease, and there is osteoporosis with vertebral fractures depending on the duration and degree of exposure to significant cortisol excess. So even after cure, long-term health also will be affected. There will be a persistent impaired health-related quality of life. There is increased risk of cardiovascular disease and osteoporosis with vertebral fractures. So this depends on the duration and degree of exposure to significant cortisol excess. So these are the clinical features of Cushing syndrome. So there is a central obesity. There are purple stretch marks, and then the thin and brittle skin in an elderly patient, and there is a hyperpigmentation of the knuckles in a patient with ectopic ACTH excess. So here on the knuckles you can see the hyperpigmentation of the knuckles in patients with ectopic ACTH excess. So what are the clinical features? So the clinical features are there will be a weight gain, there will be a central obesity, there will be a rounded face, a fat pad on back of neck, buffalo hump. Body fat, there will be weight gain, there will be a central obesity, rounded face, and fat pad will be there on back of neck, buffalo hump. Skin, there will be facial plethora, thin and brittle skin, easy bruising, Broad and purple stretch marks, acne and hirsutism. So skin, there will be facial plethora, thin and brittle skin, easy bruising, broad and purple stretch marks, acne and hirsutism. Bone, there will be osteopenia, osteoporosis, vertebral fractures and decreased linear growth in children. So what happens in bone? There will be osteopenia, osteoporosis and decreased linear growth in children. Muscle, there will be a muscle weakness, proximal myopathy, that is prominent atrophy of the gluteal and upper leg muscles with difficulty climbing stairs or getting up from a chair. So there will be a proximal myopathy, there will be a prominent atrophy of the gluteal and upper leg muscles, and there is also difficulty climbing stairs or getting up from a chair. Cardiovascular system, there will be hypertension, hypokalemia, edema, atherosclerosis. So if we take cardiovascular system, patient will have hypertension, patient will have hypokalemia, edema and atherosclerosis. So metabolic, there will be glucose intolerance, diabetes and dyslipidemia. In the reproductive system, women will have amenorrhea due to cortisol mediated inhibition of gonadotropin release. So there will be a decreased libido, there also will be amenorrhea. So this amenorrhea, it is due to cortisol mediated inhibition of the gonadotropin release. CNS, there will be irritability, there will be emotional lability, depression, cognitive defects, and in severe cases paranoid psychosis also will be there. In the central nervous system, irritability, emotional lability, depression and paranoid psychosis. And in the blood and immune system, patient will be more susceptible to infections. There will be a increased white blood cell count, eosinopenia, hypocoagulation will be there. There will be a risk of deep vein thrombosis and pulmonary embolism. So buffalo hump, acne, osteopenia or osteoporosis, proximal myopathy, hypertension, hypokalemia, diabetes, dyslipidemia, emotional ability, depressions and hypercoagulation will be there. So because of excess ACTH and POMC cleavage products, there will be a melanocyte pigment production. And then so excess glucocorticoid, it overcomes the ability of 11 beta hydroxysteroid dehydrogenase. So because of this, cortisol will lead to mineralocorticoid actions like diastolic hypertension, hypokalemia and edema, and this also suppresses gonadotropins, and this suppresses hypothalamic pituitary thyroid axis. So this will result in decreased TSH secretion.